Paying for you.
Good morning.
Morning.
How's my volume? Good? All right. Welcome to Williston-Richmond Rotary for September 12th already. We have Lisa visiting us again and actually like helping people check in. So I think we may have a new member on our hands. So make sure you get to know Lisa. She's pretty great. And our other visitor is our speaker, and we'll let Sally introduce her in a little while. But first, we're gonna have our Rotary Minute from Debbie.
Good morning, everybody. So I, as many of us do, turned to the Rotary magazine for my Rotary Minute this morning. And lo and behold, on the cover is the whole thing that I've been pushing anyway, which is the Rotary International Convention in Calgary in June of 2025. So I know it gets annoying when I say the same thing all the time, but I think it would be a really great time. This article, I would encourage you to read the whole article, because Calgary hosted the Rotary Convention first back in 1996, and 25,000 Rotarians from 126 countries went there at that time. And last year, Condé Nast Traveler readers voted Calgary the friendliest city in the world. So the article talks about how great it is and all the fun things to do. We have 3 people going for sure. Vince and Sally and myself have already registered, but please consider it. But I did want to make this a little bit more interesting and a little fun. So I have a little quiz for you on Rotary International Convention. So first of all, just to set the context, wanted to remind you, does anybody remember what year and where Rotary itself was first founded?
1905.
1905, that's right.
Chicago.
In Chicago. Yes, you guys are so good. All right. Okay, so when do you imagine the first Rotary convention was held? What year?
10 years.
27.
No, 18. You're going backwards. Okay, sometime after 1905. Right? It was earlier than 1927.
1920.
No, it was 1910, actually, in 1910, and that was also in Chicago. And only 60 people went, but they had it. Okay, so where was the first convention held outside of the United States? And I'll make this a multiple choice. So was it Toronto, Canada? Was it Edinburgh, Scotland? Or was it Ostend, Belgium?
Scotland.
Scotland, that's right. And it was Edinburgh, Scotland in 1921. Okay, where was the first convention held in Asia? We had fast forward quite a bit before we made it all the way to Asia, but again, I'll do multiple choice. Was it Tokyo? Was it Seoul or New Delhi? Tokyo, yes, Tokyo in 1961. Okay, and the last multiple choice question is, where was the best attended, the most attendees convention held? A, Osaka, Japan, B, Sydney, Australia, or C, New York, New York?
Yeah, New York.
Not New York, no.
Sydney.
Not Sydney, no, it was in Osaka. It was in Osaka in 2004, and there were over 45,000 people that were registered. All right, so we can be part of that big group. The biggest thing I've ever been to is a Katy Perry concert, and there were 15,000 people. So I'm looking forward to going to the Rotary Convention.
That if you're in hospice, you're gonna die. You're about to die. And hospice is quite different than that. So I thought it would be really good for us to have someone come and explain hospice to us. So the title of the presentation is Home Health and Hospice in the Community. It was billed as being presented by Caitlin Bombardier, and she's unable to come. But happily, Maya Fehrs can come because Maya is a former Williston resident and knows more people here than I do. So Maya has served as the Director of Development at Home Health and Hospice since November 2020. She attended Macalester College in St. Paul, Minnesota, began her career in development at a hunger relief nonprofit in Minnesota and at the University of Michigan. She was born and raised in Williston and she's happy to be back in Vermont and to serve the community. I give you Maya Fehrs.
For Maya?
Yes.
There you go.
Very good, Debbie, and Vince.
Yeah, well done. Tech support. Thank you. Should I stand here?
Yes,
Is that best?
yes.
Okay, thank you. I am so delighted to be here today with all of you. Thank you so much, Sally, for inviting me. This is really, really wonderful. My name is Maya Fehrs. You heard a little bit about me. I was born right here in Williston and went all the way through the Williston schools, then to CBU, and then spent quite a bit of time outside of the state before being drawn back. And I'm so happy to be back here with my husband. And we are expecting a baby in January. A growing family. I would love to start, and thank you, Sally, for sharing your origin story with hospice. I would love to hear, just by a quick raise of hands, and only if you're comfortable, if you've had any kind of personal experience with either home health or hospice, not necessarily with this agency, but any agency. I've got my hand raised. Okay. That's nearly every hand in the room. And I think that that's very telling, the different ways that this work touches each of our lives in so many different ways. Vince, could we go to the next slide?
Sure.
All right. Just love that quote. Caring for others is an expression of what it means to be fully human. We can actually go to the next slide to get started. Okay, so home health and hospice, UVM Health Network, home health and hospice. We were known for many, many decades as the VNA. So that may be the name that you still know us by, and that is quite all right. We'll talk a little bit more about our affiliation history, but about 6 years ago, we changed our name to UVM Health Network, Home Health and Hospice. And that was reflective of our affiliation with UVM Health Network. And I'm happy to answer any questions about this because I know that can be sometimes confusing. So as we say there, we are healthcare practitioners who provide high quality, compassionate care wherever patients call home. So the vast majority of the care that we provide is right in your home. And that starts with before you're even born, with prenatal care for families and children, and then all the way through end of life with hospice care. So really this organization walks beside you throughout whatever you need in your life. I think some really key things about that is that being able to receive this care at home allows people to regain lost independence. That's something that we talk about a lot. So you might think about a common scenario is someone is in the hospital, maybe they've had a hip replacement, and then they come home and get referred to home health care. So that's like a common one way that someone might come into this work, but it's much more broad than that, and we'll talk about some of the programs that we have. So I love to say we go where our patients are. So you might think about healthcare happening in a big building with a lot of people, but I want you to think about in this scenario, our service area, which is Chittenden and Grand Isle counties. And so every single day, our clinicians are driving to the furthest reaches of our service area, also the most dense parts in Burlington and Winooski, and they are providing care to just about 1,000 people every day are on our service. So if you think about that many people in one building, that's a very big building. But that's the care that's happening all over the community every single day. So we do provide care 24/7 everywhere throughout our service area. You can go to the next slide. All right, so we focus a lot about our programs enabling clients to do what matters most to them. And that's true whether you're in home health or whether you're in hospice. That's a huge part of our hospice. The hospice philosophy is that your goals of care are based on what you want out of your life. That is what it is all focused upon. And that's true whether you're recovering from the hip surgery or some sort of an accident where you received care. And that's also true in the final weeks and months of your life. So our clients are able to direct their care based on their own goals, live in comfort and physical safety, and really, really crucially involve family members in their care. And that's a huge part of the model. And I think that that is really allowed to happen because the care happens in the home. Which means that our clinicians are able, in many cases, to build just the most amazing relationships.
And I am in the very fortunate position as a fundraiser to get to witness that because people will call me to tell me how meaningful this relationship was. And those are calls that I get every single week and I'm a couple years into this role and they haven't stopped, just like bringing me to tears every time. Because it really is impactful, the relationships that are built. And you can imagine what comes next from that. If clients are able to build really, really trusting relationships with their clinicians, they're able to really share what their goals are. They're able to share other things about their life that might not immediately seem pertinent, but really are. So we serve people in some of the wealthiest areas of our community and also some of the poorest areas. And that means that our clinicians are able to recognize when there might be an unsafe condition in a home. They're able to recognize when there might be food insecurity for any family member of the home, and they're able to refer to those resources. So I think that's a really wonderful added benefit of providing care in the home. So you can go to the next slide. So I wanted to start with a little bit of history, and I did notice that Rotary has us beat by 1 year. So the VNA was founded in 1906, which is a fact that I am personally exceptionally proud of. I think that is incredible. We have been serving this community for over 100 years. And we were founded by, I just love this story. So at that time, there was a study or some information came out that noted that Burlington had one of the worst child mortality rates in the country. And there was a group of women who said, that is not acceptable. And so they, led by Julia Smith Wheeler, who you see pictured there, went door to door raising money to be able to hire one nurse. And that nurse went around on her bicycle. We have photos, not from 1906, but some wonderful photos from the 40s and 50s of our nurses on bicycles around the community. And so that one nurse would go into homes on Battery Street, which was at the time one of the poorest areas in Burlington, providing care for children. So since then, we've grown a lot. We've added a lot of different programs. We have a lot more than one nurse who work for us. But I think that concept of seeing, I don't want to call it a problem, but seeing a need in the community, seeing a place where we can come in and fill a need, that is absolutely still core of the work that we do. Of always looking and seeing what are the needs, what do our clients need, and how can we meet those needs. So today, we care for over 4,000 people every single year, which is absolutely incredible. We have over 2,000 donors every year, which is wonderful. We have over 200 hospice volunteers, and our hospice volunteers are the most amazing people I have ever met. We have folks who have been volunteering for over 40 years for our hospice program, which is incredible. And then we have folks who join us every year and each bring something so special. I love this stat. So in 2023, which is the last year that we have complete data for, of course, our service area is small, Chittenden and Grand Isle counties. That's not a huge service area, but we had support from 45 of the 50 states, which I love to think about because I think that shows that while our service area is small, our impact is huge. It stretches across the whole country. And as I noted before, about 7 years ago, we affiliated with the UVM Health Network. So a lot of people have questions about what that means. And I think one of the biggest questions that people ask is, so does that mean that you merged with the medical center? What does that mean? It's complicated, but no, we did not merge with any other organization. We are still a separate 501c3 nonprofit, but we are affiliated or a partner organization of the UVM Health Network, which is made up of 6 hospitals in Vermont and Northern New York, us as a home health and hospice agency, and then there's a medical group as well. And so really what we're able to do as a network is work to find efficiencies and work to collaborate better. So for us, many of the people who are coming through our services are coming right from our own medical center, which makes sense. That's the hospital in our area. And so it really helps us provide better continuity of care when we are able to have this kind of seamless interaction with our hospital and then with all of the hospitals in our area. All right, so our programs, and we like to say that we care for people at all ages and stages of life. So like I said, you may start on our services before you are even born. So we have our family and children's program, which cares for pregnant people and families with young kids, both with more pediatric rehabilitation, but also with family support and nursing. So really wraparound support for those families who are on that program. I want to take a moment to speak briefly about our longitudinal care program, which I think is one that is so innovative and I think has opportunity to really transform the way that we provide care here in Vermont. So the longitudinal care program came out of clinicians recognizing a gap. And so the way that home health care works is it's episodic. And that's the way that it's billed through Medicare or Medicaid. So that means that you get out of, let's say someone has a stroke, they're released from the hospital, they receive care from us. We're only able to care for them until they're better. But what if they have chronic conditions or social determinants of health that will make it very likely that they will end up back in the hospital again? We're not able to care for them beyond when they get back up to that baseline. So the longitudinal care program allows us to do just that. So it's not funded through reimbursement. But what we're able to do is follow a client through the long term and really provide wraparound care. And what we're showing through the data that we're collecting is that we are reducing hospital readmissions for those clients, which is obviously much better outcome for the clients, so much better for their quality of life. It's also better for all of us because it means that there's less utilization from those clients of our emergency department, which means lower costs for us all. So it's really a win-win situation. And we were so fortunate to apply for and receive some funding from the state of Vermont this year in order to do an impact study. And the goal of the impact study is to really build the data set to prove that this model works and then to build in sustainable state and federal funding for the future so that this program can maintain without philanthropy or without grant funding. And then I'll jump to hospice. And Sally, I would love for you to join in and aid me with anything that I miss. But hospice, Sally is so right, is an area that there's a lot of misconceptions around. It's really an amazing program that each of us are entitled to. We're entitled to it through being a citizen or a resident in this country. And so hospice, you become eligible when you are deemed to have 6 months or less of life, which is of course an art, not a science. So a doctor will make a referral to hospice when that is appropriate. And what's really, really powerful about hospice is that it's completely focused on what are your goals for the time that you have left. And people have very different goals. For some people, it may be, I want to be pain-free. And so that will be one pathway that we can follow with that individual and their family. Their goal may be that they, want to participate fully in certain family activities. And so we'll be able to address their care in that direction. And hospice provides so many benefits that are so wonderful. So when you are on hospice care, you are entitled to, you're entitled to this chaplain support, spiritual care. You're entitled to volunteer services. So people can come and sit with you and spend time with you. We have Reiki volunteers, all kinds of amazing volunteers, social workers who will speak with you and your family to help you process everything you're going through, and grief support. And all of these benefits are also benefits that your family is able to receive. And I think the grief support for families is something that I just can't overestimate how important that is. So everyone who is on hospice, their family members are able to receive grief support for a year after their loved one dies. And so we provide hospice care in the home and also at the McClure Miller Respite House. So the majority of people will receive hospice care in their home. And in that case, I think that can be really, really beneficial because you remain in your home. And your family members are your primary caregivers, but you have the 24/7 support of a skilled nursing team who are able to come in and help with that care. Miller Respite House is an inpatient hospice residence, and that is appropriate for people in many, many, many different situations. And it really, really has a range of benefits. But I think you can think about someone who, let's say, doesn't have a family caregiver who's able to provide that care. They can come to the respite house and receive that care in a 24/7 facility, which is designed to be home-like and has a really beautiful calming environment.
I just have a couple.
Yeah, absolutely.
So, first of all, I was on the medical advisory board for this organization for many years, and I learned something interesting about hospice. Sometimes when someone comes into hospice, their picture is bleak. They obviously get referred by their physician. They often, well, maybe not often, but not infrequently, get so much better with this kind of care and this kind of family support that they actually can move out of hospice. Or as Maya says, instead of surviving maybe 3 months, they may live up to another year, because they're so much better and they're so much more supported. The other thing that I learned in my personal experience with my mother-in-law is that, in her case, she was at Shelburne Bay in assisted living, and then she moved into memory care, and she went on hospice and memory care. Before that, she was being shipped off to the emergency room every time she fell, because the people who supported her in assisted living or in memory care were not nurses. So they would put her in the ambulance and send her off. With hospice care, the hospital and the doctor are often taken out of the picture so that the hospice nurse gets called. She comes and sees mom and says, well, she's really okay, up her aspirin or whatever you're treating her with. And then she gets to stay right where she was to begin with. I think we were able to prevent at least 3 ambulance visits to the ER in Vermont because of hospice. And again, for her care, she, I'm sure, lived longer than she would have had she not had hospice. So it's an amazing program and one that people need to become more and more familiar with, because of all the benefits that there are. The last thing I'll say is that part of my, no surprise, part of my advisory position was about family and children services. I have never been, I was a resident, I worked in several hospitals. I have never been in a program that was so careful about data collection as this organization. They can tell you at any point in time how they're doing in terms of hospital visits, urinary tract infections, all kinds of data that they collect. And they're, what's the right word? They're very specific about collecting data and making sure that they're always doing better than they did last week, last year, last decade. So anyway, that's all I have to say.
Thank you, Sally, that was awesome. Let's put a next slide. This is an area that I just wanted to quickly touch on. You may be familiar with the Visiting Nurses Association, VNAs of Vermont. So that is an organization that serves the entire state of Vermont, and basically the entire state, county by county, is split up into different service areas. So every single county in our state is covered by a nonprofit home health and hospice agency. So we, of course, cover Chittenden and Franz Isle counties, and we have partners who cover all of the other counties in Vermont. And we're able to come together as part of the VNAs of Vermont, which really allows us to share information, to learn from each other, to be good partners. And that's something that we see happen, very, very frequently, where someone may move over a county border. we don't just drop their care. Of course not. We work with our partners to figure out what is the best transition. Is it best for them to remain under our agency's care? Or do we need to transition? And how do we work with the individual and the family to make that a really positive transition? So as noted, there are 9 local independent, not-for-profit home health and hospice agencies that serve the entire state, with over 1 million home visits yearly. That's amazing. If you can imagine those caregivers going out in our community 1 million times every single year. You can go to the next slide. This is just a really quick story, and I did bring a couple, yes, I thought maybe you might. John was so kind. He gave us the gift of being able to tell his story. I brought a couple of copies of our most recent newsletters, and we featured John's story, so you can read the full thing. And I hope you do. But John, as we say here, was able to live independently, but he needed help. And I think this kind of a story is one where John is an independent soul. He did not want to leave his home. And so we were able to work with him as an agency to figure out, what do you need to be able to live independently for as long as you can within your home? That was his goal. And so we were able to help him meet that. And so you can see some of the things that we supported him with. The article goes into much more detail, and I think it provides such a human picture of what this kind of wraparound care. So John had a care team, which would have been led by a nurse, but he also had other folks who would come and visit him and provide different specialized care. And so really that wraparound, and that quote from him, if it weren't for home health and hospice, I don't know what I would have done, probably the nursing home. And for him, that was not the answer right now. So a really beautiful story, and I've got copies for you to see. We can go to the next one. Okay, we can go to the next slide. So this is where we get into, all right, what's coming for us in our community? So I think it's not hyperbole to say that long-term care is in crisis. And I think that this won't come as a surprise to any of you who have been following the news. So as you know, nursing home and assisted living facilities are closing throughout our state. The ones that are open, they're at max capacity. They're not able to take people. So we know that there aren't enough beds. We also know that in our hospitals, which you've probably been hearing, they are at max capacity. Which is really, really a challenge as a community. So we see that some patients can't leave the hospital because they need specialized care. They're not able to go home because it wouldn't be safe for them, but there's no place to send them that is safe. So that's a real issue. And so that's something that we're really thinking about in home health and hospice, because the same thing that's happening in our hospitals is also happening in homes, where people are receiving home health and hospice care, which is good, but if their needs are higher than what can be met by home health care, that's an issue, where there can be safety issues, dependence issues, where that person might be more appropriate in a different setting, but those settings don't exist. And so that's the kind of thing that we need to think about as a system of how do we create the spaces for people to be cared for where they need to be, where their needs can be met. And so that's something that, so our president, her name is Christine Wernicke. She is incredibly wonderful. And so she's working with the other presidents and leaders throughout the UVM Health Network and throughout so many different organizations in our community. We are lucky to be part of a rich nonprofit tradition. If you think about Howard Center, Cathedral Square, so working with all of these local organizations that have skin in this game to think about what are the solutions for our community, because we know that our state is aging. We know that for all the folks who are not in the right place right now, those numbers will grow unless we do something. So that's something that we're really heavily focused on as an agency, and it's obviously not something that our organization can do alone, but working across the community to come up with solutions. So you can go to the next slide. Again, I think this is not going to be a surprise to any of you, but workforce challenges have hit healthcare in a huge way. So we know, and this has been known for, quite some time, but our nursing programs are simply not turning out enough, or not graduating enough students to meet the care needs across our entire state. And this is absolutely true in Vermont, and may even be compounded by the issues that I'm sure you're hearing all the time about folks who may want to move here, but can't find a place to live, or there's different challenges there. So that is something that we are feeling absolutely in healthcare. And I think there's some pretty dire stats there that you see there. So that's something that we're focused on as an agency, where we feel like we can have some control and make a difference. And we know that we can't just focus on recruitment and retention if the people aren't there. So how do we build the workforce of tomorrow? How do we identify the people where this might be where their passion lies, and identify them in high school or college or at any point in their career, and help them have a bridge into this pathway, into what can be a really, really meaningful and good, really wonderful career. So this looks like going into high schools. We're partnering with local guidance counselors to talk to students about careers in home health and hospice. Partnering with the Hannaford Career Center to work with students, partnering with our nursing college to bring home health and hospice care deeper into the curriculum, so people find out about it sooner. Okay, this is a slide that I love, and I'm sorry if it's a little bit small. I'll definitely make sure that you have these slides afterwards, so you can take a look. But this is really to show the value of home and community-based care. So you can see the top is hospice, and the two bars are both cost within hospice, but they show high, low. And that's because there's differing costs depending on your acuity levels. But it gives you a sense of, for an average person, what is the cost per day for hospice, and then home health, then a skilled nursing facility, and then our hospital. And so really what this demonstrates is that, especially for home health care, but for hospice as well, the cost to our community is so beneficial based in contrast to these other types of care. And so the more that we're able to care for people in home-based and community-based settings, we know that the outcomes can be really positive. We have the data, as Sally noted, and we know that the costs can be so much lower. So again, it's that win-win for the individuals who need care and for our community. Thank you, Ben. Okay, I'm sensing that maybe I'm at the end of my time.
Very close.
Questions?
Yeah,
You can take another, like, maybe 5,
okay,
3.
yeah.
3 to 5.
Why don't we move right to questions, and I will make sure that Sally has the presentation and Vince has it as well, so we can send it out to everyone. Yes.
Vermont has a unique thing, the end of life legislation that we passed among, it's rare among states. Has that option for people affected the care that you provide?
So that's an area that I don't personally have a lot of information on. I believe that we cannot directly support that type of care, but it's absolutely part of the milieu. So I would love to find out more information from the director and get back to you. Thank you for that question. Yeah.
Mine isn't a question so much. My husband was at respite house. And my family to this day is so grateful for the kind of care that he had there. Between the staff and the volunteers, you couldn't have found a more supportive group of people. And although he was only there for 2.5 weeks before he passed away, it gave us a chance for those last couple of weeks for us to just be a family again. We did not have to be caregivers, and that made a gigantic difference. And I was able to stay in his room. This is when they were still here in Williston, just before they moved. And so I could stay there around the clock. And the kind of care, even in the middle of the night, was so impressive. I understand that it's really great to be home, but in his case, they said that he just couldn't be. Anyway, so it isn't a question. It's just keep in mind when you're telling people that it really does give a family a very different way to end somebody's life. Yeah.
Thank you so much for sharing those reflections. That really means a lot. Dr. Novak.
Ditto on everything that Jude said. And I'm curious if you could just mention something in the way of volunteer opportunities in your work.
Yes, thank you so much for that question. Yes, so volunteer opportunities, as I mentioned, we have over 200 hospice volunteers, and it is such a robust and amazing program. So our volunteers are highly skilled. They receive a multi-week training that is mandatory for any type of volunteer service. And that is because the work that they do is so important. And there's a couple of different ways. I'll come to you. Yes, volunteers are absolutely amazing. There's numerous ways that you can support both at the respite house, which really works for some people because they can have kind of a set job, set hours. And then we also have volunteers in the community who will go out to our hospice clients and provide all different types of care, which is so meaningful. I hear all the time from family members who will call me to say how much of a blessing it was to have the volunteer or the caregiver come. So if you are interested, we are prepping for a new volunteer class in a couple of months, I think in the spring. So please be in touch, even if you just want to find out more and you're not sure if you want to sign up. And Sally will make sure.
Send us info on that. I can include it in a email.
Perfect.
That'd be great.
In the
I
booster.
just want
Oh,
to, I just want to say that I went through the training program several years ago and then volunteered for a few years at Respite House. And the training program is wonderful. Really, really positive. You form some good friendships as well. You learn a lot about yourself.
So glad you went through that. Thank you for sharing. Okay, last question.
I am an OT and I worked with the VNA down in Massachusetts in the 90s and I resigned from VNA here in 2020.
Okay.
So seeing people in their homes though, like when I had worked in rehab hospitals,
Yeah.
people would be like, oh, but you're trying to teach them to do things, before they go home, but this isn't like my house.
Yeah.
So seeing and working with people in their homes is huge and you do see the progress. Like, it's just so different than how people respond to therapies in a center. And yes, the VNA, VBM Home Health and Hospice is a phenomenal, fantastic organization. Thank you.
Thank you for saying that. I'll come meet you after.
All right, thank you so much.
Thank you.
That was fascinating and we all appreciate you and what you do. And one more thing that can you pick our winning raffle ticket?
Yes.
And you can just read the last three numbers. And then Sally has a little something to say to you.
All right, our last three numbers are 1, 5, 8.
Yes.
Ah.
So to thank you for your presentation, you made a donation in your name to the mentoring programs at Wilson Center.
Thank you.
Thank you. We appreciate you and everything you do.
Thank you.
Amaya, you're welcome to stay. We're gonna do a little businessy stuff and a little inspiration stuff and sharing and things. And you can stay or go, whatever you choose. All right, I'm gonna do a couple short business things and then hand it over to Susan for our inspiration. So I just got an email from Armand. They are 2 days away from reaching the end of their journey, but they're also gonna be away during Veterans Day. And so he's looking for someone to take over running the Veterans Day observance. He will help them organize, but he needs someone to do it on the actual day. Any volunteers? Chris? Anyone else want to help Chris with that?
Come on.
All right, someone's gonna step up. Think about that. They'll be gone November 5th to December 2nd, so they're not gonna be here for that. And we're gonna pass around the volunteer sheet. And so if you've put in any hours, then please put them on there, and I will hand it over to Susan for our inspiration.
Thank you, Elizabeth. Hi, everybody. I thought for our inspiration today, I would build a bit on what Barbara talked about last week with dealing with anxiety and sleeplessness. And I found a little something in this book, Don't Sweat the Small Stuff, which maybe some of you have heard of. Where there are 100 great tips to improve our lives, but tip number 10, learn to live in the present moment. To a large degree, the measure of our peace of mind is determined by how much we are able to live in the present moment. Irrespective of what happened yesterday or last year, and what may or may not happen tomorrow, the present moment is where you are, always. Without question, many of us have mastered the neurotic art of spending much of our lives worrying about a variety of things all at once. We allow past problems and future concerns to dominate our present moment, so much so that we end up anxious, frustrated, depressed, and hopeless. On the flip side, we also postpone our gratification, our stated priorities, and our happiness, often convincing ourselves that someday will be better than today. Unfortunately, the same mental dynamics that tell us to look toward the future will only repeat themselves so that someday never actually arrives. John Lennon once said, "Life is what's happening while we're busy making other plans." When we're busy making other plans, our children are busy growing up, the people we love are moving away and dying, our bodies are getting out of shape, and our dreams are slipping away. In short, we miss out on life. Many people live as if life were a dress rehearsal for some later date. It isn't. In fact, no one has a guarantee that he or she will be here tomorrow. Now is the only time we have, and the only time that we have any control over. When our attention is in the present moment, we push fear from our minds. Fear is the concern over events that might happen in the future. We won't have enough money. Our children will get into trouble. We will get old and die, whatever. To combat fear, the best strategy is to learn to bring your attention back to the present. Mark Twain said, "I have been through some terrible things in my life, some of which actually happened." I don't think I can say it any better. Practice keeping your attention on the here and now. Your efforts will pay great dividends.
Thank you so much. And now I will hand it over to Chris.
Oh, I wanted.
That's you.